Hello, everybody. Welcome back to another episode of the Sean Kelly Show. Today, I've got some information that's just come out over the last few days. Some information that's probably not really made it to the front lines due to all the election campaigns and everything to do with Kamala Harris and Tampon Tim and his stolen valor, and then all the back and forth. Because the government loves to sneak things under the radar on the back side of things to where people don't really know it until it's too late. This here I'm going to talk about has to do with the United Nations and the World Health Organization. Um, the World Health Organization has called an emergency meeting in order to address an international outbreak of the deadly monkeypox virus, along with the bird flu. Um, they've had countless cases in Africa, in the Congo, um, the communities surrounding them. It's starting to be a pretty big outbreak. The numbers have dramatically surged here lately. I got a few videos I'm going to play for you here in a minute, which one of the guys is Peter um, Hotez. He's a vaccine guy, and he's going to talk a little bit about the vaccines or what their plan is. He said he's already talked to the Biden administration about everything. Um, so, yeah, it's definitely something to probably pay attention to and keep your eye out for, especially once you hear what he has to say. Um, so just hang tight and watch this clip, and then I will be back with you here in a moment.
Fortunately, I have to give you a very long, I don't know the answer to your question answer because it is very complicated. And quite honestly, the health sector doesn't know what to do because this is now first and foremost a political problem. And what I've said to the Biden administration is the health sector can't solve this on its own. We're going to have to bring in Homeland Security, the Commerce Department, Justice Department to help us understand how to do this. And I've said the same I met with Dr. Tedros last month in Geneva, WHO, the Director General, to say, I don't know that the World Health Organization can solve this on our own. We need the other United Nations agencies, NATO. This is a security problem because it's no longer a theoretical construct or some arcane academic exercise. 200,000 Americans died because of anti-vaccine aggression, anti-science aggression. And so this is now a lethal force and now I feel as a pediatric vaccine scientist, it's just as though it's important, just as it's important for me to make new vaccines to save lives. The other side of saving lives is countering this anti-vaccine aggression.
All right, now if you didn't fully understand what he was talking about, the anti vaccine aggressors and everything else, that is pretty much every American who refused to take the COVID-19 vaccine. We are considered the aggressors. That is why they're talking about bringing in Homeland Security and bringing in all the other United Nations to help support whatever this mission is that he is referring to. It sounds to me like a whole bunch of United Nations soldiers in America trying to force vaccines upon everybody. And let me just be perfectly honest with you, these vaccines that he is referring to are experimental vaccines. None of these vaccines are approved by anybody. These are all experimental vaccines that he's referring to. I'm going to play a clip from um, Dr. Tetros that he was talking about to let you watch that clip, and I'll be back right after that.
In light of the spread of mpox outside DRC, and the potential for further international spread within and outside Africa, I have decided to convene an emergency committee under the international health regulations to advise me on whether the outbreak represents a public health emergency of international concern. The committee will meet as soon as possible and will be made up of independent experts from a range of relevant disciplines from around the world.
So it is a big deal to have Peter Hotez and others saying, let's put NATO troops during the next pandemic and the UN troops in America.
Yeah, I definitely have to agree with him that it is a big ordeal to put UN troops in America to try to combat anti-vaccine aggressors and try to make people take a vaccine that's not even approved or anything else, is experimental. It's not going to end well for anybody if this does go through and happens, because and listen to what this conversation is about, because they're discussing it a little bit further.
And so they're trying to militarize medical dissent. They're trying to criminalize medical dissent. And so listen to his language. And I've made this case ever since I wrote The End of America, and I looked at how democracies turn into fascist states or totalitarian states. There's always this mission creep with language where free speech turns into violence. Whether it's incitement or subversion, or in his case, he's coining some phrases that have probably been focus group tested, and there's probably a campaign with a global ad agency waiting in the works to release them. Anti-science aggression and anti-vaccine aggression. Well, that makes you and me, my friend, aggressors. Anti-science and anti-vaccine aggressors. So who's being aggressed? We're creating victims. He's claiming that we've killed 200,000 people through our anti-science aggression. That makes us murderers. This is a brilliant rhetorical tactic to deflect from the fact that I'm saying that they're murderers, right? That they created a mass murder through these injections.
All right, now that you got a little bit more information from several different people and organizations, the New York Times published on May the 16th, due to the Pride events scheduled worldwide over the upcoming weeks, and then because of the Olympics coming up end of July or August, which they're going on now, the U.S. officials are bracing themselves for a return of the mpox or monkeypox. So I did see a clip from one guy from InfoWars. Now, he did say that the CDC had already issued a warning from New York to Los Angeles. They're supposed to be putting up billboards and everything else. I haven't found anything about that online. I know the AMA has done a couple small interviews discussing the potential of the monkeypox making it to the U.S. Right now, it's pretty much contained to the Democratic Republic of Congo and several other cases outside of Africa. So the CDC is focusing on encouraging Americans at higher risk to become vaccinated before the virus resurges. The agency's outreach efforts include engaging with advocacy groups and social media influencers. I'm not sure if you're familiar with the monkeypox outbreak from a few years ago. The highest population of people that seem to be at risk statistically based on the last outbreak has to do with your LGBTQ population, just because of the way that it is generally transferred from one person to the other. So, yeah, it's definitely something to keep an eye on. And they also said even if the deadlier clad or the new version of the Mpox were to emerge in the United States, American children would be less likely to be exposed to Mpox and less vulnerable to it than those in the Congo. Just mainly because most of your children and nowadays are all vaccinated from anything underneath the sun that you can think of. But it can be transferred by direct contact with an infected animal, dogs, squirrels, surfaces. It says the adult cases in the Congo have likewise been attributed to interactions with infected animals or close sustained contact with infected people. Sexual transmission among young male and females, primarily sex workers. So it's definitely going to be something to keep an eye on. And the reason I say that primarily is because of the Olympics. You have millions and millions of people coming in from all across the world to compete in the Olympics. You have people coming with them to watch. You have news crews from all across the world. And then, not to mention, the immigration problem that everybody is having across the world. Spain, the UK, the United States, everybody's getting immigrants from all over the world, and it's very possible that any number of those people coming over could have been exposed to it at one time or could have it and could bring it to the United States. It's a very valid concern to be focused on. The vaccines, they're saying that they've been tested or they have shown to be effective, I think was the wording that they used. There is a test in the United States that's been approved by the FDA to detect all versions of the Mpox, but cannot distinguish between which one you actually have. So if you do test positive, then you got to have more tests done to try to identify the exact type or clad of the Mpox. Which I'm assuming it makes it extremely hard to vaccinate against the Mpox if there's multiple different strands. So I'm not sure how pumping people full of vaccines is going to help when there's multiple different strands of Mpox. So that should be something to be aware of as well. But I'm going to keep a close eye on this, and the more information I get, I will bring it out to you as soon as I possibly can to keep you updated. But this is about all I've found so far until the WHO have their meeting and figure out which way they're going to go with it. So, thanks for watching.
The UN says they are set to declare monkeypox and bird flu a global emergency. And from New York City to Los Angeles, California, they're putting up billboards and running TV ads saying time to wear the mask again, time to take all your shots. The Biden-controlled FDA, that's literally run by Big Pharma, has gotten emergency authorization for the bird flu mRNA poison that does absolutely nothing to protect you, obviously. It's total insanity. So it's official. With just 90 days left, the most important election in world history, or technically 89 days, we'll put it on screen. They are going to try to roll out a global freak-out pandemic yet again.
All right, bear with me. This is going to be the last portion of this video, but this is also the most important portion of this video that coincides or goes along with the United Nations putting troops on the ground in the United States. Pharma and WHO team up to create permanent pandemic market for mandated experimental vaccines. Was published on August the 7th, just 2 days ago now. Says Big Pharma and its key investors are rolling out a new strategy, the full takeover of the public sector, specifically the World Health Organization and the regulatory system that now holds the entire market hostage. Has a lot to do with patents being hard to get, or the patent cliff, as they call it, by 2030. And the domination of just a handful of companies and conventional chemical drugs. But let me fast forward through a lot of this technical mumbo jumbo and get to the real scary part. Sorry, bear with me. Anticipation is probably killing you. And anyway, according to Jones, the process of rapidly developed and mandated experimental drugs was first adopted by the United States military for bioweapons threats. Now it is being internationally legitimized by the WHO through the agency's revisions to the International Health Regulations, or IHR, and its continued attempt to push its pandemic treaty. So, according to Jones, it will not be one that depends on the free will of consumers to opt in and opt out of products, but instead relies on tactics of forced consumption and manipulation of regulatory paradigms. At the forefront of this push are the WHO's public-private partners, private stakeholders who directly shape and benefit from this policy. Their influence has, in effect, turned the WHO into an arm of Big Pharma, one so powerful that it already demonstrated its ability to morph the entire international regulatory process for the benefit of the pharmaceutical industry during the COVID-19 pandemic. So once again, it's all about power, control, and money. The stakeholders include private sector giants like Bill Gates, go figure. Dr. Anthony Fauci, go figure. Rockefeller Foundation. So the goal, Jones wrote, is to institutionalize the procedures that were put in place globally for COVID-19 to pave the way for a new pandemic market. Clearly, they have it outlined as a business, except for this time, you're not going to be able to opt in or opt out, which is where the United Nations troops come into play at, to where you're going to be forced to take it whether you want to take it or not. So that is definitely something that everybody needs to pay attention to and keep focused on. Like I said, they've buried this in the media for the most part, because everybody's so focused on the election and the campaign and all the riots and everything else that's going on in the world right now, that this hasn't caught a lot of attention, and especially with all of the illegal immigrants that are flooding the country, not just the United States, but Spain, United Kingdom, everywhere else. The possibility and likelihood of the spread of mpox or monkeypox is extremely high, especially with the Olympics. People come from all over the world to the Olympics, bringing whatever it is they have with them. So buckle up. It could be a long ride ahead, and it'll be way worse than what it was when it was COVID. So I will keep you posted on whatever new information I can find when it's available, and I will let you know. So thanks for watching.